Good morning, and thank you for letting me come to see you this morning and tell you about what happened recently when my dad was discharged from hospital. My dad's 84 years old and he lives with us, and a while ago he was diagnosed with diverticular disease. His old GP has retired recently, and in the past, when Dad's passed blood in his stools and had pains in his stomach, his old GP said that it was a flare-up of his diverticular disease, and with antibiotics it used to clear up. We used to keep an eye on him. He didn't really want to go to hospital, and well, there was nothing else that they could do for him really. Whilst he was in hospital, he was a little bit confused and slightly weak on his legs, and he got up one morning to go to the toilet, and because of his weakness he fell on the way to the toilet. He forgot to use the nurse call bell. I was so relieved when I found out that he hadn't hurt himself, but it really knocked his confidence. I noticed as well that after Dad had fallen that he wasn't drinking as much fluid as what he should be. So I said to him, I said, look Dad, you really need to be drinking more. And he said, yeah, but then I'm going to be needing to go to the toilet more. I realised then that he was frightened of falling again. The doctor at the hospital said that Dad had a urine infection, and that's what was causing him to be a little bit more confused. A few days later, the ward sister, she came to talk to us. She said that Dad would need some physiotherapy before he could go home. She said that he'd need something called intermediate care, and that he would be going to Mount Vernon Hospital for this to help get him mobile again. The next day she told us that there wasn't a bed available at Mount Vernon Hospital, and that he would be going to Manor Home for the physiotherapy treatment that he needed. I asked the sister if there was any chance that we could take Dad home, and she said that she'd need to speak to social services. Since this happened, I did ring social services, and they said that Dad's case wasn't anything to do with them. I've no idea really why the nurse said that it was up to social services to decide whether Dad went home or not. Dad was transferred to the care home the next day, and when I got there to see him, he was sat in this room, and when I saw him sat there, well, I cried. I mean, don't get me wrong, the care worker was lovely, but the room was, it was horrible. It was dingy, and it just seemed so isolating. You see, Dad had been on a ward with other patients, and he'd fallen because he tried to go to the toilet on his own, so how was he going to cope in a room on his own? I said to the staff, I said, look, I'm really frightened that Dad's going to fall again because he's in a room on his own. And the care worker said, shoot, well, he needs to use the nurse call bell. Well, I knew that was easier said than done. I said to the lady in charge, I said, please, can I take Dad home? You see, nobody had asked me or Dad whether he needed more physiotherapy. And I told everybody that Dad lived with us and that he didn't need to be able to do much really. The lady in charge, she said that she'd need to speak to Dad to see what he wanted to do and whether he could make his own decisions or not. Well, he was so clear he wanted to go home. Please don't leave me, he said when I walked into his room. I couldn't just leave him there. You should see that room that Dad had been given, and then you'd know what I mean. We took Dad home the same day. He was only in the care home for a few hours. And when he got home, he enjoyed a nice soak in the bath, and everything's fine now. I did ring the nurse at the commissioning office to ask if Dad could have some physiotherapy treatment at home, and also to ask why he'd not gone to Mount Vernon and why he was sent to the care home. If Dad needed some physiotherapy to help get him back on his feet again, then why can't he have that in the comfort of his own home? I did ring my dad's GP, and since then Dad's now getting physiotherapy at home to help get him back on his feet.